and welcome back to Mother Tongue, your eyes, ears, and finger on the pulse for all parents around the world. Let's get going, shall we?
We are so incredibly excited to welcome the Mediclinic Midwives to Mother Tongue. Ladies, how are you?
Thanks for having us. We're great. How are you?
Thank you.
Yeah, surviving. I feel like, it's been a wild 4 months, but we've just started weaning. And let me paint the picture before you are like, what? What's she doing? He's a very big boy, and he needs food. I mean, I've never seen a small baby chomp down food like Rocco eats food. I mean, it's literally...
He was ready. Ready.
It's wild. It's absolutely wild. Anyway, I'm sure I will ramble on about me in due course, as I always do. So before we get into all the good stuff today, can you please start by telling our lovely listeners a little bit about yourself?
Yeah, absolutely. So my name's Lindsay. I am a registered midwife, currently working with Parkview Mediclinic. I've been a midwife for almost 10 years. I started my journey in London in the UK, and I've been in Dubai for 2 years. So currently I'm the specialist midwife and maternity coordinator, and my job is to oversee the antenatal education aspect of care. So I run a midwife clinic where I offer initial 15-minute appointments for all ladies in their pregnancy, and then they can have a 45-minute one-to-one at any stage, and also lead their antenatal classes, maternity tours, and soon we're going to be setting up hypnobirthing classes, which is really exciting.
Oh my God, so exciting!
So I'm Serena. I am originally from Italy, but I studied and qualified and then practiced in the UK. So I've been a registered midwife for almost 10 years. I then moved to Dubai and practiced a little bit as a midwife first, and then I am now the maternity coordinator and specialist midwife at Mediclinic City Hospital. So very similar position. We run the midwife clinic here as well. So you have the chance to meet me one-to-one and discuss the maternity services that we offer, and then you also see me postnatally as well for support too.
Amazing. And I mean, we all know that midwives are so key to kind of, especially those first couple of months post-birth, because it is, I mean, for a first-time mum, I remember it so vividly. I feel like it will stay with me forever. It's quite terrifying. I mean, it still blows my mind that you go into hospital, no baby, and you come out of hospital with a tiny human, no instruction manual, and it's like, okay, off you go, enjoy. I'm like, I am so underqualified.
You look in the rear mirror and you can see this little tiny human in their car seat, and you're taking them home with no clue of what to expect, what to do.
But that's why we're here, and that's what we do. And yeah, from the antenatal classes to even afterwards, we have home visits as well. So they're coming to your own home, so that basically you can get that support in your own comfortable environment instead of having to come back to the hospital, for example, which is fantastic.
Yeah, that has been a real change since I had my first, because again, that wasn't a thing. You know, when he was born and it was kind of post-COVID, you were expected to go in, I think 5 days after I left hospital anyway, not 5 days after he was born. And again, just going in the car full stop. I mean, this time round, I was like, well, I'm not going anywhere. I'm just not. I'm just going to stay at home. I'm not going to get out of my pajamas for days. But I want to talk about those first few days and kind of what's happened. And we've recently spoken to the lovely Dr. Tina about kind of the baby side of things. And I really want to focus on what happens from a mother's point of view, starting with our milk coming in. Now, I know this is so wildly different for every mum, but kind of what can we expect? Like, what is the window for our milk coming in? And how do we know when it's changed from kind of that thick colostrum nectar to actual milk?
Yeah, so you've touched on the colostrum there. So many ladies will actually produce the colostrum during their pregnancy. So we do recommend that from 36 weeks they can start doing some hand expression and store this colostrum, and then that can help to initiate that breastfeeding journey. It's also packed full of antibodies, so they can use this once baby's born, or perhaps within that first 6 months. So in terms of what happens after birth, once the placenta is birthed, there's a drop of progesterone which helps stimulate the release of the colostrum. So that is the first supply that the baby has, and it's
Wow.
you know it's very small in quantity because it's packed full of protein, carbohydrates, and it helps the baby to clear the meconium, and it supports their digestive system. So what happens is in the first few days they have this colostrum, and then the baby tends to cluster feed. Night two can be rough. And that's the baby sending as many signals to the brain to let down the prolactin. So by kind of day 3 to 4, sometimes up to 5, is when the milk, the mature milk, will start to come through. And that tends to be when moms feel that their breasts are heavy, they can hear more audible swallows, and the volumes are increasing with baby's demands.
Okay, and in terms of like increasing that supply, when we're kind of like, oh, the milk is coming in, is there anything we can do at this point to kind of really help boost that supply?
So usually the baby is the best, of course, to boost that supply, and keeping hydrated is the most essential part of when you're breastfeeding, because of course the hydrations will make sure that the body is healing well and also producing the milk for the little one. So that's one of the top tips that we can give to our mums. And also, of course, in our hospitals, the lactation consultant will come to see the mums, and it's very important that we assess the latch of the baby onto the breast, because, of course, that latch, if we succeed with the latch on the first, even on the first feed, of course, that will try to reduce the risk of the main challenges during breastfeeding, for example, cracked nipples, and then that, of course, with having the latch of the baby correct, it will reduce the pain and it will increase the milk supply as a result too.
Just to add on to that is one of our concepts in the hospital. So we are baby friendly, accredited hospitals. So we operate a room and in policy. So if baby is, healthy, no medical factors, they should stay in the same room as their parents. And this is all to do with responsive caring for your baby, feeding your baby, because we don't want to look at time schedules. Instead, babies should be feeding like 8 to 12 times, but they should be telling us when they're hungry. So with Room and In, we encourage moms to do regular skin-to-skin contact, and this skin-to-skin stimulates the baby's interest in feeding and supports their digestion, antibodies, all of these huge benefits, vital signs, and that's going to support that early supply of milk production.
And the responsive feeding actually goes both ways, meaning that it's not just the baby asking for the milk. Sometimes as the milk comes in, as Lindsay was saying, after 3 to 5 days postpartum, what happens, the mummy might feel like the breast is now heavier. So if the baby is asleep, she can kind of try to wake baby up and latch baby on, like starts with some skin to skin, so the baby will then become interested as well. So it's both way responsive feeding.
So I actually, with all 3 children, I have had wildly different breastfeeding experiences. And I feel like I've experienced nearly every part of breastfeeding, apart from mastitis, which I've been very lucky. And we'll come on to that in a bit. But you talked there about a good latch. Now, my first actually had a great latch, and he drank a lot of milk, and I had an oversupply because I was pumping as well as feeding, and I was like, I'm all over this. I'm all over the breastfeeding. My second, she had an okay latch, but I remember with her, there was this period. I was in hospital for probably 2 days with her, and I remember she latched really, really well at the beginning, and then as my milk came in more, her latch got worse, and she really struggled to get onto the boob. And I remember sitting outside the hospital, like, she's screaming, I'm crying, she can't latch. And I was like, what is going on? Why does this happen? And like, can latches change over time?
Yeah, I think definitely a factor there is if you have a great milk supply, you can be, slightly engorged. So if your breasts are so full, it can be difficult for baby to get that good kind of latch, because if you imagine almost like a fully inflated balloon, and baby trying to stay onto that surface area can be really difficult. So what we suggest in those instances is doing some massage with the breast and maybe just doing a little bit of hand expression to soften the breast tissue, and doing that can really help the baby gain that deeper latch.
Yeah, because the deep latch is what is important, and by deep latch we mean that the nipple and part, like most of the areola, which is the darker part around the nipple, needs to be in baby's mouth, so that the nipple is touching the softer palate of the mouth and not the harder palate, because that's how then you end up with cracked nipples otherwise. So of course that deeper latch, and as Lindsay was saying, when you're a little bit more engorged as well, they get a bigger volume of the milk, so sometimes then struggle to kind of swallow because they're like, oh, okay, the milk is now coming in. That's what we want. At the same time, then they realize, oh, it's a little bit too much, so they just need to adapt to the milk supply. So that's probably why that has been happening as well, which are all good signs, but at the same time having the support, like continuous support, so from the hospital and then also outside of the hospital, so you can either come back to the lactation consultant or having someone come into your home from the team is really essential, because these changes will happen, so it's just about tackling them when they're happening.
Yeah, sure. And I mean, we talked there about obviously good latch versus bad latch. Now, what about tongue ties? Because I know tongue ties also can play a really big part in someone's breastfeeding journey. And again, in my experience, I've had it that babies have been checked for tongue ties at birth, but then a tongue tie gets worse or more obvious the elder the baby gets. So when it comes to tongue ties, how often should we be checking if there is a tongue tie? And what kind of signs might appear if there is a tongue tie present?
So the paediatrician will do a head-to-toe check on baby pretty straight after birth, and sometimes, so there's two different tongue ties. There's an anterior tongue tie. This tends to be more easily to see. We often see a heart-shaped tongue. The frenulum, which is a little bit of skin that attaches our tongue to the base of our mouth, is quite short, so quite often we can see that the baby's a little restricted with lifting their tongue to the roof of their mouth. Now, the posterior tongue tie is more difficult to see, especially in those early days. And it's kind of not black and white. Tongue ties don't always cause any issues with feeding. Sometimes, you know, babies can get used to this and actually they feed really well. So it's difficult to say. If we see that tongue tie early days, it's almost thinking, is it beneficial to tell this mom about this tongue tie? Because is that going to affect her confidence with the feeding? And if baby doesn't get that latch immediately, it's going to be, that's because of the tongue tie. Whereas it may well just be because of the position that she's holding the baby. So it's
we always try to kind of like assess the baby for it, so every baby does get assessed, but then it's about having again the support from the lactation consultant and our staff. So if the latch is not compromised, then there's no need to act on the tongue tie, because the majority of tongue ties actually are, well, very hard to detect sometimes, and not detect until maybe later on. And then if later on, if it becomes an issue, of course, again, we can act on it when it then becomes an issue. But if the latch is appropriate, then there's no need to, you know, intervene in any ways.
Yeah. In the event that there was a severe kind of anterior tongue tie, we would ensure that the baby was referred to the paediatric surgeon to have a consultation to look at, okay, do we need to consider a frenulectomy, which is the snipping of that little bit of skin? But this is more for like the severe cases that we see.
Okay. And you talked there about positions. Now, again, I've always fed all my babies in the exact same position. I guess we call this habit. It's always buggered my back. So in hindsight, I wish I'd learned more. What kind of position? I mean, I know it's going to be really hard to describe them to people who are listening, but can you just name some of the positions, and then maybe people can Google it and look into different options?
Actually, positions, I mean, if you think about it, baby can actually feed in any positions. They can probably feed upside down, it doesn't really matter. But the most common one, so when the baby is just born, probably you will find that the baby is kind of like alongside the mum's body. So that's the most natural one as well. And then you will have, as the mummy is healing and she's feeling more comfortable to move around as well, so she's not maybe restricted to a bed, you will have the cross cradle. So the cross cradle is when the baby is across the mother chest. So sometimes this position, like it's the most common one, is the one that probably mummies see the most and they use the most, but it can be quite uncomfortable for mummies, for example, if they had a cesarean birth, because it puts a lot of pressure on their tummy. So what we sometimes show them is placing the baby under their arm, and this is called football position. This position is quite handy as well, because mothers can see the baby's face and the nose as well. So again, if you said, if you can like kind of search on the website as well, you will see what we mean, and the mother is able to see the latch and to support the baby. And it's actually quite good for when, for example, if you're, I'm dominant right-handed. So I would have more support in holding the baby's head with my right hand. So that means if I'm doing a cross cradle position, so I'm feeding on the left side of like the left breast, then I might find it a struggle to do the opposite position. So holding the head with my left hand, that I don't have much power and control. So what you do, you use the football hold, which means you're using your same dominant hand, but you're emptying the other breast, which is my right breast. So this is all positions that we show, and we make sure that the mother is comfortable with before going home, because then you and your baby will have a favorite position anyway. And one that we also use for overnight is the lying on the side position on the bed.
Yes, I liked this one actually.
This is a favorite. Yeah.
Yes, it is. So it's basically mummy's lying on her side and baby's also lying on the side, so that we keep that position of the baby in line, like from the head to the toes. And it's quite comforting, and it really increases the bonding with your baby as well.
Yeah.
For overnight, not having to disturb yourself getting up and going on a chair or on the couch to kind of like feed. So it's really good.
Love this one. Love this one. Now, I wanted to talk about milk. Now, obviously, we talked to Dr. Tina about weight gain in, babies typically lose weight when they're first born and then are expected to get it back up to birth weight in those kind of first week or two. And there's a lot about, obviously, the milk that you're producing and making sure that you as a mum are having enough calories to make calorie dense enough milk, let's say. But there is also something called fore milk and hind milk, which again, as a first time mum, I had no idea what this was. When someone mentioned it to me, I was like, so can you just explain to us what is fore milk? What is hind milk? Why do we need our babies to be drinking both?
Yeah. I remember a lactation consultant that I worked with 10 years ago. She explained it to me as it's the fore milk is the starter, and then you get to the main, and then you get to the pudding, which is that hind milk, that fatty milk. It always stuck with me. I really like that. But yeah, the composition of the milk changes as the feed progresses. So when the baby initially latches on, they're actually going to get the high water content. So this is great for quenching the baby's thirst.
Okay.
It's not high in fat, so this is why we say allow the baby to feed as long as they want on that breast. Okay, so we shouldn't be restricting feeds to like 15-20 minutes. It should be a case of the baby latches and then they spontaneously let go once they've had enough. And that's so that they get from the fore milk to that hind milk, which is more calorie dense. And we're probably going to find that. Did you ever see your children where their eyes roll back after the feed and they are just so floppy and relaxed? Yeah, that's the effects of this hind milk.
Okay.
It fills them up, makes
Comfort.
them satisfied. Comfort. Yeah.
Comfort food.
Yeah.
Oh my God, I love that. Okay, yeah, no. My first was the best. My second, she loved the boob, but she would fall asleep every time she drank. Literally every single time, and she would wake up all the time in the middle of the night, and I was like, well, this has got to stop. And my third, he had a laryngeal, whatever it is, this little flappy bit, and the milk, like, he couldn't drink it. He would like choke and splatter, and oh God, honestly, I mean, you think you've seen it all, and then something else comes, the joys. But speaking of common challenges with breastfeeding, I mean, obviously you see this all the time. What are the most common challenges that you see in clinic with mums?
For sure, shallow latch.
Yeah, and so
Okay.
nipple.
Yes.
That's as a result of the shallow latch. So
and
that,
then milk supply.
yes,
It
that,
all links into the shallow latch.
yes.
Okay.
This is the most common one. And then, of course, as we already mentioned before, briefly, the engorgement stage, which is when the milk is now starts coming in. And then, of course, we need to be careful with that and really work on the latch again and to make sure that all the ducts, because the breast has ducts like all around. So it's very important that we do empty the breast fully, because it can otherwise lead to mastitis.
Yes.
What you mentioned before, that thankfully that didn't, affect you, but unfortunately it can affect some mums, and you can feel really unwell with it, because it kind of gives you flu-like symptoms as well. So you have like a high fever, and you're feeling unwell, and you're not really able to latch baby on as well, because you are feeling unwell, and the baby is probably, at this point crying and like distressed as well, because of all the previous challenges that we mentioned, so shallow latch.
Yeah.
And also the cracked nipple. So it is very important that at this point you do get assistance from not only the lactation consultant, but we also need the involvement of the doctors, so medical staff that can then prescribe painkillers, because you will need some painkillers, and also antibiotic, because it is an infection. It's basically an infection. So antibiotic is what is going to really help with easing the mastitis.
Ladies, can you just give me 2 seconds? I don't know if you can hear, my baby is screaming and has been for the last 15 minutes. I don't know what my nanny's doing. Let me just grab him. Give me 2 seconds.
That's fine. That's great. Gonna get a guess.
Are we staying on? We're staying on track with the questions, aren't we?
I think so.
No, in terms of like we're not going off on. Yeah.
It's good.
Yeah.
No, I think it's good, because like
Yeah, it's
from a
great.
midwifery
It's-
point of view,
it's so easy. It just
I know.
flows.
It's
Yeah.
quite nice. We're
It's
just.
great.
I like that. Now we go into the mood. It's like,
We're in the rhythm.
right.
Yeah.
If I answer one, then I know you're answering
Yeah.
the next, and I'm answering
Yeah.
the next. So it's
I
good.
can tell.
Because I thought I was like, oh, who's gonna put the hands up, and then you can answer
No.
it.
Yeah. The hand would
good.
have distracted me.
I had a really itchy nose. I'm glad that the baby's screaming, so I can itch my nose. I know, yeah. It's all right. I love her mic.
I know.
Speak a little bit louder, right?
Yeah.
And I think I also kind of like, I'm trying to lean
Yeah.
because I keep myself, I think I start loud and then I go quieter and
Yeah.
quieter every time.
Same.
I don't even know where we are.
That's very loud.
Oh, we have a guest!
Oh no.
My bloody monitor's now going off.
Oh, it's all happening.
Love it.
Oh dear. The joys of motherhood. Come on in, you. Come on,
Oh, who's this little one?
this is Rocco.
Oh, hi.
Rocco.
You are gorgeous.
What a guest. Special guest.
Did you want
Yeah. Here we go. Thank you, Lisa.
You were shouting for your mama.
Yeah, I think so. I think so. Right. Let's continue. Okay, so we've talked about mastitis. Are there any other times that we need to seek medical advice? Like, are there any other things that can happen to us during our breastfeeding journey where we might need to be like, oh my gosh, this is a red flag?
Yeah, so I think for mom and baby, so if I talk about baby, if baby's ever, lethargic, not waking for feeds, nappies
Yes.
reduce, or
The urate sometimes actually, sorry to jump in, but the urate is basically an orange crystals that you might see in the nappies. That is a sign of dehydration. So that's maybe also why the baby's lethargic. So it's all down to dehydration, so not maybe getting enough milk. So anything really that the mommy needs support, we're here. So that can, of course, on a daily basis we have clinics, so the lactation consultant can see the mummies, but all these red flags, they need to be addressed to us for sure. So sometimes mommy can even address it just over the phone, and then we can assess them and be like, no, better that you come in, because sometimes you can actually address something and we can help over the phone. It doesn't need to be necessarily a face-to-face, but yeah, the lethargic and the nappies.
That's big, yeah.
They're the main ones.
And I just think that moms have this intuition when something's not quite right. And I think they just need to tune in on that. And if they need that support, then know that the services are there, they're available, and there's always somebody there that can see you, reassure you, and just to even have that thorough check through can make all the difference. You know, check the latch, check baby, check you, and that's what we're here for.
And we're here also, for example, to check the baby's weight. We don't recommend checking the baby's weight at home, because at the end of the day, we need to make sure that we assess what the weight was initially and, you know, how it progressed as well. So that's why we're here. We don't always recommend weighing the baby at home. And I know that is sometimes quite common practice maybe nowadays, because there's available scales and all sorts, but it's really important that, for example, our baby's weight, we assess it and we make sure that it's appropriate for the days of the baby, so how many days old, and along with so we need to look at the bigger picture, not just focus ourselves on the weight of the little one.
Agreed. I also want to talk about the mental load, because again, I have really struggled with this, and not so much first time round, because I feel like as a first time mum, God, it comes with its own set of challenges, but you legitimately can sit on the sofa all day. You don't have to get up in the morning for another child. Like, you can be a little bit more relaxed. But if you're struggling with breastfeeding and you have another child or two children at home or three or however many, God, it can be so difficult. So how can we make the emotional loads a little bit lighter when it comes to breastfeeding? And at what point would you suggest that it's not worth continuing on a breastfeeding journey if it's causing X amount of emotional overload to a mum?
Yeah, I absolutely think that it's about mums, you know, finding that balance. You know, is this sustainable? Are they able to continue, you know, this journey? And whether it shouldn't be a case of moms feeling like they're under pressure and that they've got, you know, guilt for not going a certain direction with feeding, but it all comes down to support. And I think really in those early days, even just having friends that can pop around, do some meal prep, make you a cup of tea, because like you said, it is full time. You could get through the day purely just breastfeeding. And if your baby is going through, you know, growth spurt, cluster feeding, they can be feeding, you know, every half hour, every hour. And it's trying to find that time even just to use the washroom can be, you know, challenging. So it definitely is about having that support network around you.
Yeah, the community.
The community, like they say, it takes a village to raise a child, and they're totally right about that. So I think it's about like talking to your friends, talking to your partners, family, accessing the support services, but also just having 5 minutes, maybe 10, to yourself. Just once the baby's down, just having a little bit of relaxation and bring yourself down, ground yourself, have that cup of tea that's not now freezing cold because it's been on the side for the last 5 hours. Or just, you know, going for a walk, which, you know, in Dubai our temperatures are, you know, higher, but to get out first thing on the morning, to get that fresh air can just make all the difference to the day ahead.
And being aware of this, you know, load that you can have emotionally prior is really, really important, because what happens, you will have the expectations that this might happen, most likely will happen. And what we can offer as well is that during the antenatal education, you're not alone. You're in a group, right?
Yeah.
So you see other mamas that are around you, and they're roughly the same gestation as you, more or less, in terms of weeks of pregnancy. So even just saying hi, I'm like, we're in the same situation here, so let's keep in touch. It is really, because I know most of us are, you know, expats, so it means that we came here and we might not have family support, unfortunately. So it's just sometimes that stranger that is in the same situation as you will support you more than any healthcare professional and any of your family members. So really, if I had an advice for mummies, is just not be shy, and if you just cross eyes with the other mummies, or even if your neighbor in the same room on the ward, be like, hi, and let's exchange number. We might need each other at some point. Just a message is all you need.
I think that's so true, because having mummy friends who either have a kid slightly older than yours that have been through everything, that you can be like, oh my God, this is happening. What does this mean? Or having someone who's going through it who you can just be like, this is shit. And then be like, yeah, it is.
Yeah.
And
Because
it's normal. That's the thing. And it's
exactly.
Yeah.
Exactly. I do think there is this amount, especially with, social media nowadays, there is this a lot of pressure to appear that you're loving motherhood. And the reality is that, yeah, I know. The reality is at the beginning, it is pretty shit. There are pockets where it's beautiful when your baby looks at you and holds your finger and, sleeps for more than 10 minutes. But it's hard. It is possibly the hardest thing I've ever done. It plays with your emotional well-being, your physical well-being, but they are really cute.
They're worth it.
we have the example there.
That was a little sweepy. I wanted to talk about pumping. Now,
Yes.
when should we start pumping? Is pumping essential? How can pumping help or also hinder our breastfeeding journeys?
Yeah.
Sorry.
Yeah, you go.
It's a skill that it can definitely be useful to learn. Initially, what we will suggest is definitely try to use that. So the best pumps are babies. That's it. That's to know. So initially, the first few days, we will always work on that latch and making sure that the baby is getting the benefits of it, and also mummy as well. You can start probably from hand expression instead of jumping straight to the pump, because hand expression can be quite reassuring for mummies sometimes, even, for example, to see the colostrum. As we mentioned before, we only have a few drops of it when baby is born. And despite that, is like full of calories and energy, so that's all your baby's needs. But it's reassuring for mommy to just see herself that it's like, oh, the drops are there, because you might not see a big flow at the beginning, which is again expected. And then hand expression, and then going into the pump, it can be quite useful as mummy maybe gets back to work, because working mums, they are out there, and so it's really important to have that option available to you. And we use hospital grade pumps actually in the hospital, and that's what we would suggest for home as well, because they are more getting the milk.
They're more powerful, aren't they? Yeah, they're more powerful.
Yeah, and they empty the breast, because I feel like this is very important. This is something, again, I didn't really know about. It is obviously from a fore milk and a high milk, and also from a mastitis point of view, it's really important that we are fully draining our boobs.
Yes. But I think
Took me a while to learn that.
Yeah, I think what's important when it comes to pumping is, those first kind of, when your milk supply comes through, so on that day 5, you can feel very full, and physiological engorgement is considered physiologically normal, because the body is sending a lot of milk down to your baby, and then your baby will regulate this on the, demand and supply talk about. So if you introduce the pump, if you are trying to get the relief matching your baby to the breast frequently on demand, but then you're also expressing, this is going to send more signals to the brain to produce more milk. So you do have to find that gentle balance of not overstimulating the breast, because then you are going to get into that cycle of having so much milk supply that it's then harder to regulate back down to just using the breast. So yeah, definitely consulting with the the midwives, the lactation consultants. And for us, we usually advise to wait until feeding is established before introducing the pump. So that's usually about like 4 to 6 weeks.
Yeah.
And then, following the advice that you get, because, even pumps are a minefield, flange sizes. To select storage guidelines. How do you give the expressed? Because if there's a clinical, indication for us to encourage you to start pumping on the ward, say you're, day 3, perhaps there's a reason that you need to increase that supply, or baby's having, some difficulties with latching. When that breast milk is expressed, we do recommend that you give this to baby via a flow cup. This is because babies suckle different on a teat than what they do on a nipple. So actually on the nipple, they should have that nice deep latch. If they suckle on a teat, then they start to use that shallow latch, and the sucking motion is different. So the flow cup kind of mitigates that, differentiation.
Confusion.
Yeah,
and the confusion actually is more anatomical. So it's actually the muscles that the baby will kind of exercise and train are completely different, because a baby on the breast actually suckles like in a completely different way from the teat. So the muscles that they're using, they're different. So that's where the confusion then comes from, because they just have the wrong muscles trained for then latching onto the breast. So it is a really fine line. And definitely one example that comes to my head for sure is that sometimes some babies maybe are admitted to the neonatal intensive care unit. So that's probably when we start to use a pump the earliest, if the baby is, for example, requiring extra care. And so the mummy is still very willing to breastfeed. Of course, we will support that and we will encourage it. And so then we get to use the breast pump earlier. So that's one example.
What about introducing a bottle? Now, we've touched upon, obviously, in the early days, flow cups are better. And I used the flow cup with all 3 of my kids because they all came out with low blood sugar, not pressure, sugar. Let's get that right. When I know a lot of parents, especially when they have other children at home, want to introduce a bottle because it then lightens the load and they can pump and hand it over to their husbands to help with the feed. When is an optimum time to introduce a bottle? So 1, we don't distract them from breastfeeding, but also 2, we don't get into that tricky period where they then refuse the bottle, which I've been in that situation and it is a nightmare.
Yeah, so the best time, so definitely the first few days and even the first few weeks, we suggest using the flow cup. And this is until the breastfeeding is established. We don't put a date of when the breastfeeding is established because it can take 1 week, it can take 2, it can take up to 4 weeks. So in those 4 weeks, as the breastfeeding is getting established, we should avoid for sure the bottle and the teat. So definitely opt for a flow cup, a cup, or a spoon as well. And these skills will be taught to the mothers when they are in the hospital as well. Then introducing the bottle, of course, as you mentioned, it does make the life easier for mummies. So once the breastfeeding is established, then they can then introduce the bottle afterwards. They do need to be consulted by a lactation consultant because we will then let them know which teat to use to make sure that, the milk is still not going in, like it needs to be more of a flow that is not straight into their mouth. Otherwise they can choke, they get a lot of air in their tummy, and then that's how you end up with colicky babies as well. And even if you are introducing a bottle, you're trying to introduce, to keep your milk. So that's maybe then when the pumping and the expressing of the milk comes useful as well, because you can use the bottle but with mummy's milk. So it's,
and I think what's important is when we do the home visits, some of these babies are 28 days old, and moms will buy a particular bottle and teat because it was recommended, and actually that teat doesn't work for their baby. So my advice would be, if they are transitioning to the bottle, is try different teat sizes. Because actually the long teats tend to be the better ones in terms of the baby getting that effective milk transfer. And actually back in the UK, these would be often the cheapest teats that you could buy.
So
they are not
it's good.
Yeah, so it's good to get a range of different teats as well to see what works.
Bottles, they blow my mind. Honestly, I think with my first, I had a bottle shop. I must have had 50 different bottles and teats and everything else. I mean, it was a joke. With my first, we found MAM bottles, which I don't think you can still get in this country. but I found them really helpful because you can sterilize them in the microwave, which if you're traveling lots, you know, in those kind of first few, like 6 months with a baby, that is a game changer. And my eldest loved the man bottles. My second, she also liked the man bottles. This monkey, nah. Not interested at all. He's actually gone onto a pigeon bottle, which again, probably one of the cheapest bottles on the market. But finding, again, the right teat to kind of support their latch, because he's got a bit of a funny latch. He had a tongue tie and he's got a lip tie, but kind of back here. Honestly, so we had massive issues with him drinking in loads of air and, oh God,
But
never
see,
ends.
You same mom, but 3 different babies. They're 3
Yeah.
individuals, and they will require different
Exactly.
needs. That's it.
Yeah.
And it's just about finding the right one for your little one.
Yeah, exactly. You've got to try a few, sadly.
And you actually mentioned quite rightly sterilization. So every time, like the mummy then needs to introduce a bottle, it's about being aware of sterilizing equipment, make sure that you do your hand hygiene, just take the right precautions.
Yeah.
Oh yeah, sterilizing has been again. God, it's one of the biggest downsides of bottle feeding, is the sterilization and not being able to just whip out a boob and feed your child. But this time around, I actually have found it's something called the Baby Brezza Washer Pro, and I mean it's not cheap. But my God, you rinse the bottles out, you stick them in, the machine washes it, dries it, and sterilizes them. And I'm like, oh, this is amazing. Because what winds me up about sterilizers, or like the traditional sterilizer, is you take them out and it's all soggy. And I'm always worried about, when they're a bit dewy. And I'm like, what is the dew? Like, is the dew bad? And then I'm like, how do I dry it? Is what I'm drying it with sterilized? Probably not. Oh, God. So you then get into a whole cycle of, what am I doing? Why am I even bother sterilizing? Because I'm probably drying it off with something that's terrible. But anyway, sterilizing is a conversation for another day, because I could go on and on about it.
It's a minefield, for sure.
Such a minefield. I wanted to wrap this up today by asking you both a question. What do you wish pregnant mums knew before they, had their babies and started their breastfeeding journey?
Yeah, so definitely one thing that I say to all my mummies when I see them and they are almost about to give birth is that babies will feed more at night because your hormones are higher at night. So the babies are night owls and they love to wake up at that time. They love your milk overnight, and that's what is going to happen. And then they will have the most peaceful sleep in the morning. So definitely I say that to mummies to prepare them. And it is really important that the baby does feed at night, because actually that will increase the milk supply when they're latching on, and of course reducing the risk of having maybe low milk supply later on down the line.
But yeah, between 2 and 4 a.m. Wow,
Oh yeah,
babies
they're
like to party.
We are not invited at the party. They're just like him and the mummy.
And I do think it's really, really important to acknowledge that, once the breastfeeding is established, life does get a lot easier. And I think the biggest thing that motherhood has taught me is everything is a phase. None of it lasts forever. And I know at the time it is incredibly difficult to think past the stage that you're in. But it all goes quite quickly as well. I think, if you can just, as horrible as sleep deprivation is, if you can just stick through those first couple of weeks, by month 1, by month 2, by month 3, you're in a totally different phase and dealing with totally different issues.
And you'll be
So
of the what you actually sticking through maybe the hard time the first couple of weeks, because it will really help with the establishing and successful of breastfeeding.
exactly. And I mean, I have friends who have breastfed their babies, well until they're over the age of 1. Sad, all of mine, apart from my little girl, they've all had CMPA. So this is a whole other minefield, which we've discussed in many other episodes. So we won't go into it again today. But I never really got that far. And I was always very envious of the ease that, you know, they could be anywhere and they could just, as I said, whip out a boob and start feeding. There's not this mental load that comes with bottle feeding of having, as we talked about, sterilizing, but also thinking when you're going out, how many bottles do I need to take? Making sure that you've got water in the bottles, making sure you've packed the right amount of formula, you know, and then also stressing that having that window, they've got 2 hours to drink this bottle before this milk is then bad. And it comes with its own set of rules, formula feeding. So yes, if you can and it's not causing you a headache, then stick with it. But I also do think that if it's causing you massive emotional overwhelm, I still stand by the fact that fed is best, and you know, do what you need to do to survive, because
sustainable for both the baby
Yeah.
and the mother, because they come together, they come as a package, the mom and the baby, so there's not such a thing like one is more important than the other. So
No.
it has to be sustainable is one of the breastfeeding words. So
and I love that.
Yeah.
I love that. That's a really nice place to end today, guys, but I am going to ask for a product and tip from both of you before we say goodbye.
Okay, so I would say make sure that you read up. So attend an antenatal class, you know, have some reading of antenatal education in regards to lactation. So the Latch League is a great resource, and after birth, on that first kind of hour after birth, that golden hour, prioritize skin-to-skin contact and prioritize that first feed, because that really does set the agenda almost for that feeding journey. The sooner you feed after birth, it's just great. And I would say access all of the support that's available. This is key. Whilst you're on the ward, ensure that the staff are observing your feed, helping you with position and attachment, making sure that you're aware of how to access the lactation consultant and the home care services that are available, and just make sure that you are kind to yourself. This is key.
Yes.
Be kind to yourself. This breastfeeding is, yes, it's natural, it's a journey, but it's not always instinctive.
Yeah.
It's a learned skill. So yes, you know, you can do this with your baby, but you can also do this with the support of the professionals.
Yes,
And then my product would be, if you are going down the pumping journey, to look at if you're going to get an electric pump, it needs to be hospital grade and a dual pump. This will save you a lot of time.
A lot of time. I mean, I used Spectra for the first time with this nugget, and my God, it was a game changer.
Yeah.
Yeah.
From my side, I think one tip I usually give to all mummies is that try and research in advance where you would like to give birth, and if it is in a hospital settings, definitely try to choose for a baby-friendly hospital that is being accredited. So that you know what it means being accredited with this is that they support and protect breastfeeding. Definitely on the line of what Lindsay was saying is save the number on your phone for breastfeeding support, and your midwife, like specialist midwife, for example, so save their numbers and call them like something that, you know, call them breastfeeding. Don't call them by their name, because their name will be gone by the time you're home, but save it as like breastfeeding lifesaver, whatever. But yeah, that's one tip that I would give. And one product, same on the line again of what Lindsay said. Yes, a dual pump, but make sure that you have a bra to go with it. So you need to buy both the pump, the electrical pump, like hospital grade, and the bra. Why? Because when you have the bra, then your hands are free, unfortunately not for the phone or for anything else, but to make sure that the milk is actually effectively being expressed, and you know, you don't have any lumps left in the breast.
I love that. And you can actually get these bras from anywhere. It doesn't need to like necessarily match the brand of pump. Like I got one from Mum's World and it was great. Loved it.
Yeah, whatever works for the mum is
Well-fitting bra is a great.
Yeah, game changer. Yeah. And then ladies, for anyone who wants to come and find you and reach out, where can they find you?
Yeah, so for myself, I am actually the maternity coordinator and specialist midwife at Mediclinic City Hospital. So yes, that's where I am. I've every day, Monday to Friday, sometimes even the Saturdays when I'm doing antenatal classes. So for sure, we can maybe leave the numbers as well, so you can find us there.
I'll put everything in the show notes for everyone for sure. And then what about you, Lindsay?
So I'm based at Parkview Hospital. You can find me on the second floor OB/GYN OPD department, and this is where I hold my clinic, and you'll probably see me walking around the hospital.
Oh, we walk a lot.
We walk a lot. We do great steps, doing hospital tours, and doing the classes as well. So yeah, we'll absolutely leave our contact details with you.
Amazing. Ladies, you have been fantastic. Thank you so much for sharing all your words of wisdom today. It's been amazing. And hopefully we'll be seeing you both again very soon.
It's been such a pleasure.
Thank
Honestly,
you,
thank you for having us.
Thank you. Really enjoyed it.
Thank you.